Correctional health care is a unique field with unique challenges. Caregivers serve a distinct patient population that may have very little or no access to health care. Day in and day out, we strive to meet the health care needs of our patient population. But our mission does not stop there. Our common goal is to equip patients with the tools they need to re-enter their communities and become contributing members of society. To do that, they need to have their personal health managed, become educated on general healthcare topics, and feel empowered to take care of themselves. That is only possible through the hard work of correctional healthcare employees. Today, we want to take you inside the daily lives of these team members to give you an exclusive perspective of the work they do each day, the environment where they work, and the patients they serve.
A lot of our patients, this is their first experience with the healthcare system, and it's a unique opportunity to be able to educate them on their health needs and to be able to provide healthcare to an otherwise vulnerable population.
If we hire someone, we definitely want to make sure that they're very interested and want to be in this environment, because if you don't want to be in this environment, it's not going to work. They got to really want to be motivated and desire to work here.
Working in a correctional facility involves a security aspect designed to keep everyone safe at all times. Entering a facility will be your first interaction with security protocols. Many facilities have their own unique process for entrance and may involve X-ray surveillance of carry-in items, metal detection or wanding of individuals, and a pat-down search. Each facility will have its own rules on what you are allowed to bring in and what is not allowed.
The officers have a job to do, so they need to maintain security, and we need to deliver health care, so we need to work as a team.
I actually think I feel safer here than I would anywhere else. You get to know your officers. We work with the same people every day. You build relationships with them, and you're able to trust them.
In the medical area, a typical day will start as any day would start in a community healthcare setting, clocking in, checking equipment, completing shift counts, and giving report. In many areas, you will see a mix of different staff members, including security officers, social workers, medical staff, mental health staff, and others. All the different departments routinely work together to complete the daily tasks at each facility. Healthcare teams strive to cultivate and maintain an excellent working relationship and effective communication with security partners.
I'm medical and they're corrections. So the officers handle security, I handle medical. So as long as I was caring for the patients, it never got in my way. So I was able to be a nurse. You're more safe in here than you're out in the community, because at least you have an officer. The inmates are more polite than they are out in the street because they have a lot of respect for medical.
Security keeps this environment safe for all of us. It's very important for our employees to be able to feel safe, to be able to conduct their daily responsibilities, and they certainly do. This is an environment that's very well controlled, to be able to have communication on patient needs and to be able to meet those needs while our patients are within the prison system.
While the medical areas may look familiar to you, not all daily work happens here. Correctional health care is a facility-wide operation, and each facility is different. Some facilities are mass movement facilities, meaning that inmates move through the facility, oftentimes in groups for daily activities, yard time, and meals. In unit-based facilities, inmates generally remain on their units and have all of their daily activities there. Certain daily tasks, such as medication administration, emergency responses, or other clinical encounters may happen in other areas of the facility, or even in housing areas. It is essential for correctional healthcare staff to be comfortable in working these areas and to be familiar with the security protocols. We're sure you're wondering what you will be doing on a day-to-day basis. Core components of daily operations include the following: intake screenings, medication administration, primary care visits or sick call, chronic care clinics, labs, diagnostic testing, specialty care clinics, and emergency response. Not all facilities offer all services, but they are similar across the country.
What we do at Corizon is we help the state to exercise, or the county to exercise, that constitutional responsibility by providing physicians, nurses, pharmacists to make sure that that patient gets all the care that she or he needs, but only the care that she or he needs as well.
it's important for us to let our staff know and people that are interested in working in correctional health these are things that we do on a regular basis. We synthesize best practices and evidence-based medicine to be able to offer excellent care to all of our inmates.
All facilities will have some process for receiving new inmates, which may be referred to as intake or receiving. Generally, these new inmates go through a medical screening process, and this process is typically more in-depth for new detainees and more streamlined for transfers. This is an opportunity for medical staff to obtain a basic medical history and baseline data. It also connects new arrivals with the clinical services they will access while incarcerated.
It's very, very normal for us to encounter our patients that haven't had previous health care, and we are starting from zero. Getting them back up to health, getting them on the medications that they need, and levels and where they need to be at.
Sometimes they're newly diagnosed with HIV, for example, and they feel extremely grateful that they were told about it while they were incarcerated. When you identify someone with certain infectious diseases and you educate them about ways of reducing transmission to others, you are actually providing a public health benefit.
We have worked in both our jail and prison settings to have processes and programs that allow us to identify those needs and then to address those needs appropriately.
The patients that come in, they do get to improve their health, and then when they leave after they've been rehabilitated, they're definitely more educated on whatever their disease process is, and they seem to have a better handle on whatever their medical issues are.
Another core area is medication administration. Facility populations can be as low as 100 inmates or as high as several thousand. Many of these individuals require daily medications, and it is generally the responsibility of correctional healthcare staff to administer them. Medication administration, or MedPass as it's called, may take place in a central area in a mass movement facility or a housing area in a unit-based facility. This area is generally a function of the facility LPNs. Clinical encounters also take place every day. These encounters may be with a medical assistant for lab work or diagnostic testing, such as EKGs, an RN for sick call, or physicians and mid-level practitioners for either chronic care visits or referrals from sick call. Some facilities may also offer specialty clinics, such as optometry, physical therapy, radiology, or dental, just to name a few.
The medical care that we're able to offer here is very comprehensive. Everything from primary care to specialty clinics to access to outside providers through our third-party agreement. We are able to provide pretty much all of the medical care that you would receive in the community.
As you have seen, there are many healthcare services offered to patients in correctional facilities across the country. We provide innovative solutions to caring for a unique population, and we all take great pride in the outcomes that we collectively achieve.
We are patient-facing, we are patient-centered, and we are independent and dedicated to doing the right thing for our patients in every single encounter.
This is a great opportunity to truly help people that are very much in need of care, that are very much in need of education, and there's a lot of opportunity to do good for a lot of people. And if that's something that appeals to you, then this is the place for you to be.
We hope this video has answered many of your questions and helps you in your decision to pursue a career in this exciting field. Correctional health care is not for everyone, but those who truly embrace the mission of serving our patients will find it to be a rewarding career choice for many years.